Hi there, I'm back. I survived brain surgery number 1. I scheduled brain surgery number 2 today, y'all. And I just wanted to recap. I mean, it's been less than 30 days since brain surgery number 1. My plan was to post like a health vlog style like update. Not daily, but I would like to have had put out a video at least the week after, and then like, if there was more content to post, like put that out as well. However, today was the first day where I felt like I had the energy, and I don't know, it's just been number 1 priority has been my health, my rehealing. You know what I mean? And like I said, I scheduled my second brain surgery today. I got my stitches out. You can still see dot, dot, dot. I got my stitches out today. And so, I feel like for the past 3 weeks, I've been very much focused on what I can do for my body to care for myself, what I can do for my mental health to make sure that I'm caring for myself. And then, outside of those things, it's just been making sure that my dog's taken care of, making sure that my relationship is taken care of, making sure that my home is taken care of. So when it comes to putting up these YouTube videos that I really was passionate about when I started, that kind of stuff kind of went to the wayside, which is fine. Right? Which is fine, because I'm not a big channel, nobody's waiting for my vids, so that's cool. But the idea was that I would be posting daily videos similar to how some other folks who had the stereo EEG were doing, where they were like doing short reels and just letting folks know how they were doing in the hospital. I felt that comforting for me going into surgery. And so I wanted to add to that. But today I watched back a lot of those videos that I had made. And first and foremost, I felt like they were very repetitive. My head hurt. And, there were a couple of things that I'm going to mention. I have a little list of things that I had noted that were different throughout the days that I struggled with. But, I felt like for a lot of those videos, I was very repetitive, and I feel like I can touch on those things in one video. Also, for number 2, I'm having an issue with iMovie. So I really wanted to be able to stitch those daily videos. They were 2 minutes, 3 minutes long. I wanted to be able to stitch those into a longer video. And for some reason, iMovie is making it so that I can't see the audio, or I can't reach the audio in some of those clips. However, others are working just fine. So depending on how this video we're sitting in works, I may be able to stitch in some of those little clips, bits and pieces that I feel are important, or just stitch in some pieces, because I feel like I said, those things were comforting to me as I prepared myself to go into the hospital. I wanted to see what another patient experienced on their way. So with that being said, today I was able to post the prep EEG, the video the Friday prior to my SEEG. I feel like that was a good video. I feel like I touched on a few things that were important to touch on. One of the things that I had said in that video that I think is important to swing back around and touch on now is I had said that my seizures were rare and they were happening in the evening. Maybe they were happening daily, but they were happening in the evening, and I wasn't having a whole lot of issue with them. What we found out through the SEEG is that I'm having more than 20 seizures a day. So yeah, these PNES seizures that I'm having could very well be PNES seizures, but they may be triggered by a true epileptic seizure in my brain. So when I'm trying to manage PNES, you can't manage PNES if it's not fully triggered by emotional response. If you are being put into fight or flight by electric misfirings in the brain, you cannot quite determine how often that's going to happen and how quickly it's going to end. Now, if you're not somebody who's familiar with PNES are seizures that are non-electric. They are very much dealing with the emotional fight or flight response of the body, and you can do different things to get yourself out of those. If you have PNES, then you know that sometimes through mindfulness and mental and spiritual work, you're able to bring your body back to a place of calmness and stop those seizures through some real work. It's hard work. It's physical. It feels like physical labor when you're doing the mental gymnastics to bring your body back down from seizure. Let me speak for myself. For the past 4 to 6 months, I've been being told that primarily what I'm dealing with is a mental gymnastics game that I have to learn. I need to get my body from PNES seizures to calmness. Now, from the SEEG, we learned that I can't bring my body to calmness because I'm having electrical misfirings all day long. So there is no dealing with the PNES without stopping the electric seizures. We don't know what's firing what. We don't know what's happening in reality. So bringing it back around, what I mentioned in the video is, that I was having them rarely or that they were mostly happening in this lobe or this lobe. And what we learned during the SEEGs is that I'm having more than 20 seizures a day. I think one day they said I had 40. What I've been told more than once from these psychologists, neurosurgeons, is that these are the most they've seen in a while. My neurologist said it's the most he's seen. Neurosurgeon. These are the most seizures he's seen in an SEEG stint. So yeah, so just bringing it back around, I wanted to touch on that point that I made in that video because it was incorrect. It was incorrect, and I don't want people to get confused as I move forward in my journey by what you're hearing in my videos and then what you see happen in my journey. With that being said, let's talk about the SEEG. Let's talk about how it went. Let's talk about what went on. Day one, I think I got a call early morning, day one, and they said that from blood work that they had seen the week prior, they're seeing that my platelets are low. They said that I had two options. I could postpone the surgery, or I could have platelets injected. So I decided to have the platelets injected. The only thing that this caused was a wait prior to the surgery. So I had to come in a half an hour earlier or whatever in order to get the platelets injected and then meet the surgery time. So I had to go in earlier. Things had to be shuffled around just a little bit. Not a huge issue, but one of the other things that I mentioned in my video going into the hospital that I had a small bit of anxiety that I was dealing with about the surgery, not because I thought I was going to get hurt or anything like that, but because I was going under. And that's just, we're human beings putting each other out of consciousness and it's just, that's a big idea for me, and I was having some anxiety around it, but it lasted a short time and I was able to deal with it well. The other thing that I wrote about on that day prior to the operation was that you're not given a hospital room at my hospital. My experience was that I was not given a hospital room prior to the operation, and I didn't know this. So this is something that you can ask your doctor about or ask your nurses about. Where do I go prior to the operation? Where do I put after the operation? The reason why this is important is because I don't drive. So and my partner doesn't drive. So when I took my stuff down there, I took everything with me, everything that I'm going to need for 2 weeks. I had a suitcase. I had an overnight bag that had some additional stuff in it. I had a food bag. I had a little mini refrigerator with me that if you watch the video that I just posted prior, it's a small refrigerator, but when you have all those things with you and you're being told that you're not given a room, that these things need to go in a waiting room with your grandma, it makes it all fuzzy. And I'm being told these things while I'm getting put, an IV's being put in there telling me you're about to go under here soon. It's like, how do I make plans for my grandmother? I'm about to be 30 years old. My grandma's not, prime age to be carrying around all of my shit around excuse my language, around the hospital. And she had to go from one waiting room to another waiting room. And I'm bringing this to light because nobody mentioned this to me. And I think it's important that folks who are disabled and who are dealing with this kind of stuff, folks who are getting an SEEG, a lot of us don't have a license anymore. It's been taken from us. So I think it's important that we are informed about where our stuff will be kept, and have a conversation with our physicians prior. Go ahead, and when I woke up from the surgery, I made a small clip. So let's go ahead and just take a look at this together really quick. I woke up about an hour ago. I've been in and out of consciousness, but I woke up pretty fully about an hour ago. My partner was here. My grandmother was here. My head hurt really bad. Really, really bad. When they told me that I would have a headache, I didn't quite understand that it was less of a headache and more of I just got hit by a truck feeling. But it sounds like they had given me some pain meds prior to my waking, and then they ordered me some morphine when I woke. So I've had some of that in the past half an hour, and I feel a lot better. But I'm still in a lot of pain. Yeah. My partner was here and brought me ouch. So right after that, what we just listened to, I mentioned that my partner brought me some lozenges because my throat hurt, because I was given a breathing tube for the operation. The first time when I came out of operation number 1, I did feel the breathing tube path. I felt that in my throat. And I felt like the lozenges were helpful. The second operation, I don't think I felt the breathing tube at all. I'm not sure if they used one the second time, but if they did, I didn't feel that. So for day 1, as you could tell from that video, I was pretty drugged up. I had said in the video that, I was in and out of consciousness for much of that day. Day number 2, I did mention in the morning when I woke up that my headache was half as bad. Now, I'm not sure if that stuck the whole day, because later in the day I had come on to make another vlog, and I said, oh my gosh, my head hurts so bad and I can't have another medication because, one was 4 hours ago, or 2 hours ago, and I have to wait 4, and I was having some issues with how much pain I was experiencing and then the rate of medications that I was able to get. In day 2, one of the things that I mentioned in the video was that I was given news that I had several seizures night number 1. Now, the reason why that's important is because this is not necessarily normal for a lot of folks who get an SEEG. When you go into an SEEG, they normally taper you down off your medications, and then you start having seizures after day 2 or day 3 when you've had no meds or your meds have gone below threshold. However, for me, my meds weren't working. And, you know, they didn't even know how many seizures I was having a day, because right now I could be having a seizure. They told me this is the case. I'm having seizures while I'm having conversation. A lot of them, sometimes they're not making it past the last hemisphere of my, or the left hippocampus of my brain, and that's why maybe I can still articulate myself and move around. But the fact of the matter is, I'm having seizures while I'm talking to people. So with that being said, they said, you had so many seizures last night that we probably won't have to keep you the whole time. So luckily for me, I wake up day 2, you know, the second day of having the probes in my head, and I'm being told, you're probably going home early. I was like, okay, shoot, I could do this. I could do this. You know, as long as I don't have to stay the whole 10 days, I could do this. So on day number 3, that is the day that I feel like I had some of the worst pain. I experienced a lot of pain on day 3. I talked a lot about the pain on day 3. So let's just see what we find here.
Hey friends and family. It is now 8 o'clock in the morning on Saturday. On Wednesday, so it's 2 days since I've had this implanted into my skull. For the first 2 days, I was given morphine and codeine to keep the pain down.
Oh, so this video was the morning video.
Subsided.
I was feeling better in the morning. So that is the case, that I was feeling a lot better on the second morning. However, that's when I started to experience pain the night. So it was February 1st, at midnight, I woke up and I was in so much pain and I couldn't go back to sleep. So technically that was day number 4, but it was midnight of that, so morning number 4. And what was happening was I was in so much pain, and there was another patient who was having grand mal seizures at the same time that I was experiencing this grandiose pain. So this man was a heavier set man. He was broad shouldered and a bigger man, and he had a seizure in the bathroom. So while my seizure alarm's going off in my room, all the nurses run to the bathroom to get this man, because I mean, he's huge, he's on the floor, and he's having a grand mal. So I'm halfway conscious, and so his seizure is the more important seizure to take care of, because he could die through a grand mal seizure. So while I'm like having a really hard time, I'm crying and the like, they have to deal with this guy. And I liked how I behaved in the video. I liked what I said in the video, because it showed me that I have grown, and that I'm at a point in my life where I'd rather see the next person who's in need be helped than to be comforted. Does that make sense? Because I was in pain and I needed comfort, whereas this guy was in danger and he needed care. And so I just wanted to mention that, because it could maybe be a potential reminder for you if you have to deal with something in the future, or just a reminder to us all that it's not always about comfort, and that's not always the priority, especially in the healthcare system. So this is 8:15 that morning. So let's take a look at this one. I hearted this one. I think this is one that I thought was important. So let's go ahead and look at this.
Last night was really hard for me. I think I took a video. I was having a hard time getting to sleep, staying asleep. My head was hurting. I was nauseous, extremely nauseous. I'm having a hard time putting anything down, like a saltine cracker. This morning, I wake up and I'm feeling a little bit better. I got myself a little fruit platter for breakfast and a non-caffeine tea. And my mouth's still...
Okay, so in this video, I talk a little bit about how I was feeling better in the morning, where the pain had lessened, the nausea had lessened. And in this video, I talk a lot about how the jaw pain was pretty bad. So the first day, I don't think I ate anything at all. The second day, I was slurping on my applesauces that come in little slurp packages. The third day is when I started to try to eat the food, the solid foods. And I was having a really hard time getting my mouth open wide enough to put the utensil with the food in. I could get the utensil in, but I couldn't get the utensil in with food. So I think that's just a nice reminder to all those that watch me and care about this procedure, that we have to care for ourselves in the sense that we have to bring things to maximize our comfort, and that being non-solid foods. So then I was given the news. So let's go back to my notes really quickly. I was given the news that I was going home on that weekend. So I was going to be given the second operation to remove the probes from my head. And then I would also be given 24 hours to stay for safety, and then I'd go home. So luckily for me, that fifth day, you know, I was having a hard day, don't get me wrong, but I knew I was going home the next day. So that's what made my experience so much more easy to handle. It was traumatic bodily, and it was traumatic. This whole thing for me has been super traumatic because I'm fully conscious while I'm having seizures. And I'm a very spiritual person. I'm very focused on my consciousness. I want to become better. I want to evolve, for lack of a better term. You know, I don't think I'm becoming an angel or anything, but I do very much think that through questioning my consciousness and asking myself questions about how I can be better, I have become a better person. And in that way, it's become difficult for me because while I'm having a seizure, I'm asking myself what I can be doing differently. And there is nothing that I can be doing differently in a lot of these situations. So on that last day, I, just tried to comfort myself, hold myself. I really did at one point in that hospital, just continue to hug on my body and just remind myself that I care. That I'm doing the operation because I care. And yes, so the last day, one of the things that I had wrote a note in here, and I think is important. Okay. I hope that my iMovie works for that last and I can snitch these two together because my neurologist just called. My neurologist's office is called because they need to schedule something. So I'm back. The only other thing that I thought it was important to mention, not because there's anything we can do to better prepare ourselves or there's anything that we can do to control this kind of thing, but what I thought was very, very disillusioning. I don't want to use the word traumatic because I don't feel any kind of PTSD, or I don't feel the need to release any kind of emotional response to it. But one of the things that I felt was more nightmarish about all of it was the fact that the first time, and if I'm not mistaken, the second operation, the nurses introduced me to the IV that put me to sleep as something that was going to help me calm down. I remember specifically the first time the people kept coming in and saying, we're going to give you something to help you relax. We're going to give you something to help you relax. And I'm like, okay, when am I going to be given the anesthesia? And nobody came and said, okay, well, anesthesia in 45 minutes, or, we're going to go into the surgery soon, and so we're going to give you the anesthesia right before that. That was never mentioned, the drug name. I didn't hear we're going to provide you the anesthesia at any point in time, if I'm not mistaken. Because again, I have left hippocampus epilepsy. My memory is a little bit shook, but also like both times the nurses were coming in and saying, we're going to give you something to help you relax. We're going to give you something to help you calm down, was one of the, you know, because they used this language. And then all of a sudden I'm riding on a gurney down the hallway and I'm catching glimpses of, you know, people walking by or doorways or lights. And then I see the lights of the operation room, the cameras, the computers, and boom, I'm asleep. You know what I mean? This was all, it was very weird. It was very dreamlike how you catch glimpses of things. And like when you wake up in the morning and you can only remember a glimpse of this dream and a glimpse of this dream and a glimpse of this dream. That's what it felt like. It felt like they like, you know, they said, here, we're going to calm you down. Then boom, it was like, it just felt like if they would have given me a better warning. You know, I'm very much in touch with my consciousness and my spirituality. So when you take and you say, I'm going to fuck with your consciousness, excuse my language, I need to know when it's happening. I need to know. Please say 1, 2, 3 so that I can be prepared. And I felt like I was never prepared for those moments. So that was just the other thing I wanted to touch on. Other than that, healing was pretty, I don't want to say it was easy, but it was not hard. For the first week or so, I wrapped my hair with like this satin scarf so that my stitches weren't getting stuck to different materials, my pillows, you know, whatever. And I feel like that helped. My partner had back teen. That, oh my God. Okay, that's another tip. Back teen. Okay, if they're gonna be putting stitches on your scalp, if you're gonna have open wounds, back teen. Because not only did it, you know, help me to deal with some of the bacterial anxiety, but also it's a little bit of a pain relief. So luckily I was able to deal with a lot of that healing with some of the Bactine, and then my partner also used an oil on my scalp. I'm not sure exactly what it was. I think maybe a vitamin E oil or a tea tree oil, something of that nature. But I feel like my healing went well. Again, I got my stitches removed today. You can still see some redness. A little bit of blood had come out. So we're 3 weeks in and I'm still not fully healed up. But you wouldn't expect that from a cranial surgery. So I don't know. I hope that I gave something of value in this video. I guess the last thing that I'm going to mention is today that I did learn that I will be having a laser ablation of my left hippocampus. And so I think that we will have more of these videos. And yeah, I mean, I look forward to building a community on here. And if not, because like here's the thing, I'm not doing this for notoriety or anything. The only reason why I posted these videos about the epilepsy is because I was looking for them on YouTube and I couldn't find them. So I was like, let me help somebody else out by putting my story out there. So I'm not doing this for notoriety, but I am benefiting from the conversations that I'm having with YouTube. And putting my story out there and knowing that 1 or 2 people are seeing this and hearing me. I'm feeling heard because I don't have a huge family and like I've just built a support group in the past year who have been there for me through this. And so I think that, you know, by making these videos, I'm also providing myself a level of support. And I hope that you feel the same way when you watch these. So yeah, that's my video. Next time we go into my brain, we're going to be blowing shit up in there. Boo, 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 the hippocampus. All right, yeah, see you later.